Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Good morning and good afternoon and good evening, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. How are you?
I'm fired up.
Oh, boy. And you're living it up also, right?
Of course I'm living it up.
All right.
What else is there to do? You may as well, if you're going to have a good time, you may as well have a good time.
Absolutely. Well, we want our listeners to live it up, so you can call right now and speak directly to Dr. Darrow right here in the studio at 866-870-5752. That's 866-870-5752. And get your free book now when you call the program. It's Dr. Darrow's latest, called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies, and the foreword is written by the lovely Suzanne Summers. And you actually appear, Dr. Darrow, in her latest book, A New Way to Age, on pages 302 to 316, right?
That's exactly right. It's very exciting. Suzanne Summers, we love you so much. God bless you. You are a medical expert in things that work. People call it alternative medicine, but it really isn't. It's really the old style medicine that's been around since the beginning of time, that's natural. And Suzanne has been incredible. She's been through a lot in her life with medicine, and her books are really interviews of doctors like myself that are a little bit outside the box to alert the public as to what can be done for them without surgery and drugs and things of that nature. So let's get some callers here. I'd love to have you call me. The phone number to the studio. And by the way, when you call, you're going to get a free copy of my book about stem cells and platelets, Why Not to Operate, Why to Use Regenerative Medicine. What we're doing today are platelets and stem cells. Tomorrow or tonight, it might be something new to regenerate tissue. Back in the old days, 25 years ago when I started doing this, it was, believe it or not, concentrated dextrose, which would irritate the tissue and alert the immune system to bring fibroblasts to the area, which would grow back tissue. So with injuries, arthritis, things of that nature, really from the top of the head all the way down to the bottom of the feet and everything in between, we can help heal. And if you have things like meniscal tears in the knees or rotator cuffs in the shoulders, the tears, whatever that is, labral tears. Nita, you're breathing very close to the microphone today. We can all hear you.
Oh, I didn't even know I was breathing. I'm so sorry. I didn't even know I was breathing yet. It's not even 11
hold
o'clock.
Your breath.
Oh, my gosh. I don't usually breathe till like later in the day. Yeah, so
yeah,
I deeply apologize.
Yeah, it's no problem. So anyway, if you're thinking about getting a surgery, if your surgeon has told you, your orthopedic surgeon, neurosurgeon has told you, you need to get it, bone-on-bone arthritis. I scoff at all that. There are times surgery is needed, but very rarely for what I see going on. People come in, new patients come in every day, ready for a surgery, and I explain to them that they can heal by just regrowing tissue. And they say, but I talked to my surgeon about it. He says you can't regrow tissue. The reason you can't regrow tissue to a surgeon is because the surgeon doesn't read his own journals, his own orthopedic journals, because the studies are there. I've got them in my book here. And if you call me now at the studio, 866-870-5752, I'm going to repeat it for you, 866-870-5752. I am going to send you a copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It took me 5 years to put this book together, and it was done because every time I lecture to a hospital, a couple of orthopedic surgeons, neurosurgeons stand up and they go, hey, where's the research? There's no research on this. Now I just hand them a copy of the book. I actually carry these in my car. for all the naysayers, the people that go, this can't possibly work. It does work. It's not going to work on everybody, but it does work. It's worked all over my body. I've injected myself for over 20 years from sports injuries that I've had, and I will continue to do that. Although I'm 73 years old, I know it's hard to believe, Nita, but I am.
73. I think that's a mistake. I think you're 37.
Actually, inside of me, I'm 16. You know that.
There's that. Of course, of course.
I am puer aeternalis, the boy who is forever. And you can be like me, too, if you want to be. Just start eating your ketogenic diet, stay skinny, and get the load off the joints, exercise as much as you can, and be happy. Live it up like I do. And when you do injure yourself, come see me. I can inject you. You walk in, you get injected, you walk out. It's not like getting a surgery where there's all kinds of terrible side effects. I have literally seen people die on the table during orthopedic surgery. It does happen. There was a woman I mentioned on the show many times who came in. She was around 30 years old, and she came in, I forget what it was for, let's say shoulder pain. And when I was doing her history, I said, have you ever had a surgery? She said, yeah, I had back surgery. And I said, well, how's your back doing? She says, perfect. And I said, so the surgery worked? And she said, no, I never actually had the surgery. I was being induced with anesthesia for a back surgery for a herniated disc. And I had a heart attack from the anesthesia.
Wow.
And then this is the best part. She said, I woke up, my back pain was gone. Never had the surgery. So we don't know how these healings work. I see healings every day. It's a mystery to me. There's a lot of miracles that take place in medicine. And I know that it's best to stay away from medications and surgery if you can help it. Surgeries have a lot of side effects like infections, like taking tissue out, causing immediate arthritis. So the white horse that I ride is stay away from surgery if you can. There are cases, obviously, where you do need to get surgery. You have a broken bone, it's sticking out of the skin. You better get to the surgeon, get to the ER and have a surgeon come and patch you up. There are cases for it. But most of the time, in my world that I see, when someone comes in, they say they need to have a surgery. They've been to several orthopedic surgeons. They all say the same thing. We usually can get them healed up just by injecting platelets from their blood or bone marrow from their pelvis. Bone marrow is plentiful in blood, platelets, and in stem cells. So that's what we're doing these days. If something better comes along, I'll be doing it. I'll be the first guy doing it. If you want to call the office and get more information, my office number is 800-300-9300. I'll repeat it for you. It's 800-300-9300. I'm going to go to some questions until we get some callers.
Okay.
Although I have to admit the callers are a lot more fun. I'd rather you stump the doctor, give me a hard question. Anything about musculoskeletal. I'm not interested in, musculosclerosis or things of that nature, or multiple sclerosis. I am interested. Actually, I did a study on it when I was at UCLA in my residency. But in terms of the healings, I don't do diseases. I do musculoskeletal issues. Anything with joints, ligaments, and tendons. You're going to say something, Nita. I want to hear you.
Well, I was just going to say that our number here is 866-870-5752, and you want to call right now and get your free book today. And the other thing is I was going to say, sometimes when you start telling me riddles that I can't answer, people call because they feel sorry for me.
Well, I have some riddles for you. You ready?
Yes.
Okay.
Always.
You're making me laugh already, Nita. What kind of tea is hard to swallow?
They didn't chop it up and put the tea back yet?
Come on, Nita. You're smarter than that. Reality.
Oh, gosh. How'd I ever miss that?
Okay, here's a new one. What kind of shoes do robbers wear?
Soft soles.
Sneakers.
Sneaker.
You're good. Sneakers. All right, let's get to a question here that came in. And by the way, on my website, which is www.lastemcells.com, There is a spot on every page to email me with your questions. I will answer them every single day. I do emails from early in the morning. In between patients, I do emails. And at night before I go to sleep, I do emails. Here is one of them. It says scoliosis, that's a curvature in the spine, arthritis, and then pinched nerves. So there's a lot of stuff going on. Let's see what the question is. Dr. Darrow, I am suffering from scoliosis between 20 and 30 degrees. That's 20 to 30 degrees of curvature. I also have arthritis in my back. I now have one or more pinched nerves in my low back. I'm an active person. There's a key. I'm an active person. That gives me a lot of information. I'm 70 years old, 5 feet tall, and weigh 105 pounds. Will regenerative medicine help me? Thank you. I have to examine this person to be able to tell them if using platelets or bone marrow with stem cells and platelets can help them. Based on what they're telling me here, I probably can help them because they've said they're an active person. If they're active, that means that they're still moving their body around, which is a big key that I can probably help them. I would have to touch their back and see where they think their arthritis is. Many people have arthritis and have zero pain. So we have to be careful not to think about surgery because there's arthritis. I don't decide to treat a person based on their MRIs or their X-rays or CT scans. I use my hands as my MRI, meaning that I have to find the pain generator by examining the person. If I can find the pain generator, then I can generally help them heal up. The pinched nerves, they haven't talked about anything down their legs or down their arms. They said pinched nerves in their low back. That may or may not be the truth. There may not be pinched nerves. They may just have low back pain or neck pain or something like that. And that usually I can heal up without any issue at all. So good question. And the scoliosis typically does not cause pain unless it's pretty advanced. And even if it is, it's often the ligaments that are stretched out that are causing the pain. And we can inject those and thicken them up. There are studies going back to the 1980s of ligaments being injected in the back and how the tissue can grow by about 50% and tighten up by 100% or so and strengthen. So I think, this person has a good shot. That's a pun, Nita, because my work is giving shots.
Got that.
A good shot at healing up and getting rid of some of this pain or getting rid of all of it. I don't think the scoliosis will go away from what I do, but it may help get rid of the pain that's coming with all of these things this person is having. So if you want to call the office, the number there is 800-300-9300 to get more information than we're giving out on the show. And I'll give it again. It's 800-300-9300. And I'm looking for your calls. I see one coming in from Dale in Newhall. So Dale, let's take your call. You have an ankle issue. And which ankle is it?
Good morning.
What ankle is it that bothers you, right or left?
My right ankle.
Okay. And how long ago have you had this pain for?
10 years.
And what caused it, if you know?
I was going to say it started with a motorcycle accident. And I had a plate put in there.
Okay.
And the plate's been taken out.
Okay.
And the wound will not heal.
What does that mean? There's an opening to the skin, or it just hurts?
There's an opening.
Okay. If there's an opening to the skin.
I'm sorry?
Go ahead. Size of
I was going to say it's about the size of a quarter.
Okay. So here's what you do.
Uh-huh.
Have you tried to use hyperbaric oxygen to heal that?
No.
Okay. That's the key. And the reason for that is, by the way, I don't do this, but if you're willing to take down my website address, you can email me. It's www.lastemcells.com. I'm going to repeat it for everybody while they grab their pen. www.lastemcells.com. Every single page has a spot to email me. So Dale, you can email me and I'll send you the names of some places where you can get hyperbaric oxygen. The reason hyperbaric oxygen works is because oxygen heals. Okay,
Right.
it works in the healings that I do also, because the areas that I heal generally are white tissue, ligaments, tendons, cartilage, things like that. They don't have a good blood supply. If there's no blood supply, there's no oxygen getting to the area, and there's very little healing that takes place. So I've had people with 50 years of back pain, let's say. I've injected them one time, and they've healed up. How is that? Because by injecting the platelets and the blood particles, oxygen is brought to the area, which heals the area. Now you're going to say something. Go ahead. I cut you off. I'm sorry.
Oh, that's okay. At one time, this did close up, and they put the skin graft over it. And then 2 weeks later, the skin graft fell off.
Okay.
They told me that I have a deep bone infection.
Okay.
In the hospital that I go to, all they're going to treat this is I put gentamicin, Santil, and another cream on it.
Okay.
And that's it.
Well,
And
yeah, there's other things that can help it heal. And one of the best, I'm going to tell you again, and then we're going to move on, is email me at www.lastemcells.com. Let me know what city you live in, where you live, and I'll get you the names and phone numbers of places you can get hyperbaric oxygen.
All right, doctor.
And
Thank you
I'm
very
not
much.
going to
Love
promise
your
you
show.
any. Thank you so much. I'm not going to promise you a thing. I never promise anything. But there's a high probability that wound will heal.
Great, that's what I need.
And if you're left with pain after that in the ankle, then you can come to me and get some regenerative medicine to heal up the pain. Okay?
All right, Dr. Darrow, thank you.
Thanks for your call.
God bless you, man. It's good to talk to you.
So our number right here in the studio is 866-870-5752, 866-870-5752. Get your free book. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. The foreword is written by Suzanne Summers. And you're in her new book called A New Way to Age, pages 302 to 316. Aha.
Beautiful. I'd love to send out these books. Please call me. I'd love to talk to you and hear about your issues. If you're shy, just make up a fake name, and you could pretend you're talking about your mother, your father, or your friends, or maybe you have some of them with sports injuries or arthritis or musculoskeletal pain, and we can get to the bottom of how to help you. So it's time to punish Nita. You ready, Nita?
Ready.
Okay. What do you call a man that irons clothes?
Iron Man.
Oh my God, you finally got one of my jokes.
Oh my God, that's incredible.
It's taken you a long time,
I
Nita,
know.
but that brain power is
I know.
really getting there.
Maybe I need ginkgo
Okay.
biloba or something. Do you want to talk to Isaac?
Well, one more joke, though, to
Oh,
get
okay.
Isaac warmed up.
Okay.
Because I want to stump you again, Nita. You can't just get one of my jokes and walk
Oh,
away.
I was just going to be high the rest of the day. I was so excited. Okay, go ahead.
What did the Invisible Man, or why did the Invisible Man turn down the job offer?
They couldn't see him.
Oh my God, 2 in a row.
Really? Oh
he
my
couldn't,
God.
He couldn't see himself doing it. That's close enough. You win, Nita.
Wow.
I'm going to get you a free copy of my book, even though I've sent you 50 of them so far.
Yeah, but I need about 3 or 4 more copies because I give them out all the time.
I know. Thanks for referring a lot of your friends over. It's very nice.
Yeah,
I appreciate that.
somebody saw you a couple of weeks ago. He's very happy with you. Okay.
Yeah. He's getting better already. He's a wonderful, wonderful man.
I know.
God bless him.
He is.
Thank you so
He's
much
one of
for
our
saying.
veterans too.
All right, Isaac. This is Dr. Marc Darrow. Your right ankle is bothering you. Today's ankle day, Nita.
I guess.
So, Isaac, how long has your ankle bothered you?
This for my wife. She's a little bit on the heavy side. Her left ankle is kind of weak and swollen.
Okay. Yes.
And I guess she doesn't stand up straight, or she has a flat feet also. What can
Okay.
we do about that stuff?
Well, a ketogenic diet is really important. And when my patients come in who are overweight and have, hip pain, back pain, knee pain, leg pain, foot pain, ankle pain, toe pain, plantar fasciitis like your wife, you name it. I put them on a ketogenic diet, which is really easy. It's basically protein, vegetables, and water. We used to call it the Paleolithic diet, but now it's trendy to call it ketogenic. Same thing. And people lose about half a pound a day doing it. I have them text me every day, so I keep them accountable to me. And I've had people lose over 100 pounds. Let me talk a little bit more here, Isaac, then I'll get back to you. Hang on. So if people are overweight, it actually causes arthritis in their joints in the lower extremities. So I'm guessing your wife has some arthritis in her ankle where the pain is, and she's causing it. That's the sad part about it. She's got to lose weight. She's got to get off the carbs. And I could probably help her using platelets from her blood or bone marrow from her pelvis, which has stem cells and platelets in it, to help regrow some of the cartilage there. Go ahead, Isaac, take it. What else you want to tell me?
Sorry about that. What about, never mind the pain, what about treatment for the swollenness?
Is the swelling just in the ankle or is it in both legs?
Just the ankle, one leg.
Okay. Typically when I inject the ankle, the swelling goes away, okay? I can't promise anything. I haven't seen her yet. I have to touch the area, move the ankle around. But when I do ankles that are swollen for arthritis or anterior talofibular ligament sprains or plantar fasciitis, Achilles tendonitis, usually the swelling goes away, okay?
Okay.
Once it starts healing.
We'll come and see you. We'll come and
Okay.
see you. Thank you much.
Yeah, I can't wait to meet you. My phone number to the office is 800-300-9300, 800-300-9300. And if you want to watch videos of me doing the procedures to see if it's something you like, go to the website. We have a lot of videos on it, www.lastemcells.com. Okay? Isaac, God bless you and your wife, and there's good hope ahead for her.
Thanks for your call, Isaac. Our number is 866-870-5752, right here in the studio, 866-870-5752, and you get your free book with the foreword written by Suzanne Summers when you call the program today. And do check out the website, www.lastemcells.com. That's lastemcells.com. And what else do you have going around in the office today? You got other things.
We do. We actually stimulate hair to grow using platelets or stem cells. So if your hair is thinning, we can regenerate some of the follicular damage. And a lot of that can come from things like high dihydrotestosterone. And we like to check hormones and see what's going on. So that's part of the process. Also, the vampire facelift, which is injection of regenerative medicine products like your own platelets or stem cells into the face, and it regrows the collagen in the face, makes you look young and beautiful again. So, Anita, it's time to punish you one more time. I'm having so much fun. How did the barber, I know, because you're 2 for 2. How did the barber win the race?
With his scissors.
Well, kind of. He knew a shortcut.
Oh, like it. I like it.
One more, then we'll go back to some questions.
Okay.
What lights up a soccer stadium? You'll never get this one. A soccer match.
Oh, you're right. I never would have thought of that. You want to talk to Christine?
Yeah, Christine, Dr. Marc Darrow. How are you today?
Oh, I'm very well. How are you doing?
I am living it up. I am so happy, and I'm so glad that you called and talked to someone with a happy voice. That always cheers me up. So your joints hurt, and you have inflammation in your body?
Yes. Well, first of all, I wanted to thank my husband on air. He told me about you a few days ago, and I do have a scheduled SI joint injection next Wednesday.
Okay.
So I've been in pain for 6 years. I've been lifting and landscaping for 24 years.
Good for you.
Thank you. Yeah, so my back, has been hurting, and overall my body like my tennis elbow, golfer's elbow on both arms from surgery 4 years ago. Now one of my fingers has arthritis.
Hang with us, will you please? Because we're going to go to a break. And for you callers, get to us at 866-870-5752 in the studio. That's 866-870-5752. God bless you all, and we'll be right back.
We will be right back. You're listening to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens. Stay with us.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.